Good evening. I'm Dr. Jaime Estrada. I'm President and Board Chair of Texas Doctors for Social Responsibility, or TDSR, and Chair of the San Antonio Chapter of the National Hispanic Medical Association, or NHMA. I want to welcome you to our 4th annual Public Health Policy Forum entitled Uninsured in a Pandemic, Continuing the Fight for MedEx in Texas. And we all know that means Medicaid expansion in Texas. This forum is a collaboration between TDSR, the NHMA Texas chapters, and Every Texan. At TDSR, we are a diverse group of physicians and other healthcare professionals who believe that every Texan, regardless of their income, should have access to comprehensive and affordable healthcare. Our mission is to lead physicians and local communities as they advocate for a more just and cost-effective healthcare system in our state. TDSR has been at the front line of the fight to expand health insurance coverage through Medicaid in Texas since 2014, when we published an op-ed asking the legislature to expand Medicaid to provide coverage to the uninsured lower-income Texans, as was mandated by the Affordable Care Act, but made optional by the Supreme Court. TDSR was the first group of medical professionals who openly advocated for the expansion in Texas. Established in 1994 in Washington, D.C. by Dr. Elena Rios, the National Hispanic Medical Association is a nonprofit representing the interests of more than 50,000 licensed Hispanic physicians in the United States. NHMA is dedicated to empowering Hispanic physicians to be leaders who will help eliminate health disparities and improve the health of Hispanics. There are 3 NHMA chapters in Texas: El Paso chapter, chaired by Dr. Bert Johansson and Dr. Carlos Correa; the Rio Grande Valley chapter, chaired by Dr. Frank Fernandez; and the San Antonio chapter, chaired by me. Dr. Rios, President and CEO of the NHMA, will follow in welcoming you to this event on behalf of NHMA. Every Texan, formerly the Center for Public Policy Priorities, or CPPP, is a recognized nonprofit organization in Texas that researches, analyzes, and advocates for public policies to expand equitable access to quality health care, food security, education, and financial security for all Texans. This evening, Every Texan's new CEO, Marisa Bono, will give the keynote address. This will be followed by a conversation where a panel of experts on the expansion, including Ann Dunkelber from Every Texan, Dallas County Judge Clay Jenkins, economist Ray Perryman, CEO from the Perryman Group, and San Antonio's grassroots activist Sofia Sepulveda from the Texas Organizing Project, will discuss the human and economic benefits of the expansion and why coverage expansion is absolutely critical for our state. Ms. Bono will moderate the panel. Dr. Johansson and I will then give the closing remarks. As you know, the disparities in access to healthcare have been exacerbated during the ongoing pandemic. A recent study in 2020 found that more than 1.4 million Texans would be eligible for the health insurance coverage under Medicaid expansion. Texas can afford and should make this critical investment to expand health equity in our state. Through this forum, we want to send a message to the Texas legislature that we will not give up in our demand for them to do the right thing and accept the billions of federal dollars on the table, our tax dollars, to expand Medicaid for the benefit of our uninsured and working poor and for the benefit of our state's economy. I would like to thank our TDSR board for their support over the years, Dr. Elena Rios and the NHMA Texas chapter's chairs, Marisa Bono and her team at Every Texan, and our distinguished panelists for their participation in our public health forum, and the Methodist Healthcare Ministries of South Texas for their continued financial support. Now, I'm happy to introduce Dr. Elena Rios. Dr. Rios.
just want to get on. Very happy to be here. Thank you, Jaime, for your leadership in Texas, and Bert also, who is our chairman of the Greater El Paso NHMA chapter, and to all of our partners tonight. My name is Elena Rios. I'm in Washington, D.C. I'm the founder and president and CEO of the National Hispanic Medical Association. But I have to say, I've known Dr. Estrada since we founded NHMA back in the 90s, because he was very involved in San Antonio with another medical group at that time. We visited medical groups around the country to be able to get the green light to start our National Hispanic Medical Association. And we've been working together ever since. The NHMA is very proud of the policy forum tonight, and the advocacy done by all of our partners in Texas. And we look to you for leadership on how we can get more involved from the national level and also from the chapter levels. We have been in Washington, D.C. working primarily with the Congressional Hispanic Caucus and Congressman Dr. Raul Ruiz, who is the chairman of the Hispanic Caucus. We've written letters with our sister Hispanic organizations asking for the Medicaid gap to be decreased, and especially in states like Texas, to do what we can with the Build Back Better reconciliation bill, and to have as many Congress and senators pass that bill that would call for it. You know, we don't know what's going to be the end result as they whittle down the amount of money that would be supported in this bill. But we hope that people realize that the very basic fundamental access to healthcare is having insurance like Medicaid. And with that, we can have more people be healthy and functional, have better students, have better workers, have better military from our communities. And we all know that in America, 1 out of 4 Americans will be Latino or Hispanic by the year 2042. So if we can take care of the Latinos in our country, we can take care of America. So thank you very much on behalf of the National Hispanic Medical Association. And I just want to thank all of our staff, including Ariel and Jasmine, who are part of the logistics staff tonight. Thank you very much.
Bert, would you like to introduce our keynote speaker?
I am incredibly honored to introduce Larissa Bono. She's a lifelong social justice advocate and thought leader. She joins the Austin-based Every Texan in 2021, becoming the first Latina and the first woman of color to hold that position, to serve as executive director. She's an attorney, which has experience in both specific poly expertise and social equity, especially as it relates to education, immigration, voting rights, and political access. Before coming to Every Texan, Larissa served as the Chief of Policy to San Antonio Mayor Ron Nirenberg and Chief Strategic Officer of VIA, the Metropolitan Transit in San Antonio, where she successfully led an initiative to expand service for working families and low-wage workers so they could get to their jobs on time and reliably. Earlier, Larissa served as the Southwest Regional Counsel for the Mexican American Legal Defense and Educational Fund, MALDEF, which is currently involved in the voting rights situation here in Texas. It is the nation's premier Latino civil rights law firm. Ms. Bono has a law degree and a master's degree in public policy from the University of Michigan and a bachelor's degree in political science from Rice University. And I am incredibly honored to be on a panel with her.
Thank you, Dr. Johansson and Dr. Rios and Dr. Estrada. And thank you, TDSR, NHMA, and Methodist Healthcare Ministries for hosting this convening on such a critical topic for our community and for our state. The fact of the matter is, as we meet here together this evening, we are sitting in the middle of a crisis. And I know when I say that word, I know all of the minds all automatically go to a health crisis. I know that most of our audience and panelists this evening have spent the past 18 months on the front lines of a global emergency unlike anything that we've seen in our lifetimes. And you're all too familiar with the face of this health crisis and what it has meant for your practices, your patients, their families, and yours. And frankly, I really shouldn't continue without thanking you for the crucial role that healthcare providers play in keeping all of us safe. We are living in unprecedented times, and your sacrifices during this time are truly extraordinary. But the crisis that I'm referring to today is not the health crisis alone. I'm referring to a moral crisis. In very real terms, we are confronting the question, during unprecedented times like this, what are our values? Now, I'm a Texan, as I believe many of you are, and I was born and raised in San Antonio. I'm talking to you from my home in San Antonio right now. And in the brief period of time that I left this state to attend school, everyone knew where I was from because I told them, and they probably never forgot it. I'm incredibly proud to be a Texan. I'm incredibly proud of Texas. But just because we're proud of where we come from doesn't mean we can shirk away from the hard questions. What does it mean? What does it say about our values as Texans when even prior to the start of COVID-19, the start of the pandemic in March of 2020, the number of uninsured Texans reached over 5.2 million in 2019. 5.2 million of our neighbors did not have access to basic health care even before the pandemic. That was 18%, twice the national uninsured rate. What does it say about our values as Texans when we stood idly by after the pandemic hit, as almost 700,000 adults in this state lost their health insurance coverage, as job losses and closures disrupted pathways to coverage for millions of people across the country? And what does it say about our Texan values when we've held an unprecedented 4 legislative sessions, plenty of time to deal with tough policy problems, real policy problems, yet not even once did we see a proposal on the floor to cover almost 40% of our uninsured population, more than 1.4 million people, through Medicaid expansion. By the way, a vast majority of those left behind are workers. They live below the poverty line and they're people of color. These are the same folks who throughout the pandemic rang up our groceries, prepared our food, cared for our elderly, made sure we could still get to our jobs. They kept the so-called Texas miracle, our economy, running, even though their frontline jobs are disproportionately less likely to offer health insurance and have placed them at a greater risk of contracting the virus. And the failure to act is despite the fact that Medicaid expansion is a smart financial option for states. The federal government pays about 62 cents of every dollar of care Texas Medicaid provides. With the expansion, the federal government would pay about 76 cents on the dollar. Now, Texas Medicaid is a $40 billion per year program. So regardless of your morals, regardless of your ethics, the numbers don't lie. Medicaid expansion is a sweetheart deal for Texas. So a jaded person, a cynical person, would look at the convergence of these statistics and say that Texas is a place where the individual truly trumps all other considerations, and that we don't believe that policymaking should be guided by the care for our most vulnerable. A jaded person would look at these numbers and think, we're perfectly okay with other Texans, Black, white, brown, rural, urban, falling farther behind as long as our own families are holding their own. But that's not the Texas I know. When I think about the Texas I know, I think about the brutal winter storms that we faced together earlier this year, where in crisis, the best of our humanity was on full display. We saw regular civilians rescuing stranded drivers. We saw people delivering supplies and food to people they didn't know, paying for it from their own pockets, and urgent attempts to shelter and protect the most vulnerable, our children and our seniors. Instead of calling for others to just pull themselves up by their bootstraps, we were focused on making sure that they had boots at all. That's the Texas I know. And I am unconditionally optimistic about the future of our state. Helping friends and neighbors in need is the Texas way. I know many of you feel the same. And guess what? The numbers bear that out too. Texas polling shows that a majority of Texas voters support expanding Medicaid. A recent study by Episcopal Health Foundation confirms that 70% of Texans think the state should expand Medicaid to provide health insurance to more people, and almost 60% say the state should increase spending on healthcare. And that, by the way, that's more than those who say the same thing about public safety and infrastructure. So with an easy financial path and broad bipartisan support, how the heck did we get here? I think the answer is simple. Our elected leaders here in Texas didn't listen to us. We just finished a marathon of 4 legislative sessions, a general and 3 special sessions that the governor called. And while targeting transgender school children and battling non-existent election fraud were identified as priorities during these sessions, somehow ensuring that Texans have health care during a pandemic and a recession was not. Although it wasn't for a lack of trying. In fact, a bill proposing coverage expansion under a Texas 1115 waiver was supported by 76 Texas representatives, a majority of our 150-member House in the regular legislative session this year. Unfortunately, it was not even allowed a hearing, much less a vote, by our own elected state leadership. Despite billions of federal dollars being left on the table, strong statewide public support, and the backdrop of a once-in-a-lifetime pandemic, Texas legislators failed to act. At our annual legacy event this year at Every Texan, we honored the president of the Ford Foundation, Darren Walker, who is a native Texan himself. And he spoke of feeling both pride and rage in this state that we love. And I thought that was very appropriate for our current state of affairs. And so we're left together now in this moral crisis. And it's at the point of crises that our assumed ways of doing things don't always fit the world that we live in. Our moral commitments are no longer tacit rules that we follow by habit. At the point of crisis, we must try to discover how to do things differently, how to think differently, how to act differently, and how to recalibrate and even reject how we've done things before. And that's my challenge to all of you tonight. I don't want you to just listen to our panelists. I hope you'll engage. For everyone listening, I hope you'll be inspired tonight to ask yourself, what can I do differently to get us out of this moral crisis? Just by convening today, I think we're already doing things a little bit differently. I've rarely seen panels like the one that we put together today with healthcare providers sitting side by side with a policy expert, an economist, a community organizer, and a county judge. The mere fact that you made it a priority to be here today to be part of this conversation is an important next step for our path ahead. Danny, if you could put screen 1 on. The reality is that Texas is unlikely to expand coverage without federal action. And as you'll hear in more detail today, Congress may step up where our local elected officials have failed. Congress remains divided over whether to craft a comprehensive and permanent plan, one that doesn't leave people behind and won't lapse a couple of years down the line. There's a huge fight happening in DC right now on whether Medicaid expansion will be included as part of the Biden economic package. We need our representatives in Congress to keep fighting for this, especially with their colleagues in the Senate. We're asking each and every one of you to join us in this fight by calling on Congress to pass a comprehensive and permanent solution to connect more than 1 million Texans to healthcare. Again, nearly 3 in 4 Texans in the Medicaid coverage gap are people of color in a majority minority state, and thousands have already died in the coverage gap. We simply can't wait any longer. We need action now. Visit sickofittx.org to take action on this front. Danny, next screen, please. And we also need your continued voices at the Capitol here in Texas. We'll continue pushing for better healthcare access in Austin, no matter what happens in Washington, D.C. As healthcare providers who are on the front lines, you have valuable perspective and frankly, credibility that is not often heard enough on these issues. We ask that you join our listserv at Every Texan to follow our calls to action as we continue to fight here at home in Texas, and that's everytexan.org. The more Texans engage on this issue, the better this state will be, and the closer we'll be to our vision of the Texas that we truly want to be. Thank you for being here tonight. I'm excited to get started with our program, and I'm going to begin by introducing our panelists, each of whom will bring their own area of expertise to this vital conversation. And I'll go ahead and start that introduction now with Ann Dunkelber. Ann is the Health and Wellness Program Director at Every Texan. She oversees our healthcare policy. She is a founding member of the statewide Children's Health Coverage Coalition and the Cover Texas Now Coalition. She's been recognized for her advocacy by Families USA and the LBJ School Alumni Association. Ann literally wrote the book on Texas Medicaid. She was the primary author of the first edition of Texas Medicaid in Perspective. It's also known as the Pink Book. And she serves on the Texas Medicaid Managed Care Statewide Advisory Committee. Thank you for being here with us tonight, Ann. We also have with us Dr. Ray Perryman. Dr. Perryman is president and CEO of the Perryman Group and an economic research and analysis firm based in Waco. He's held numerous academic positions. He hosts daily radio commentary, and he holds a number of awards for his work, such as the Cesar E. Chavez Conscience Builders Award. And he was named the most dynamic economic researcher in the US by Global Business Insights in 2018. Dr. Perryman dedicates a significant portion of his time to pro bono work, which we're so grateful for. It's aimed at helping to solve pressing social problems such as hunger, indigent healthcare, poverty, and child maltreatment. Thank you for being with us, Dr. Perryman. Judge Clay Jenkins has served as Dallas County Judge since 2011. He was the first leader in Texas to put restrictions in place to mitigate the spread of the coronavirus in March of 2020, such as limiting crowd size and issuing a shelter-in-place order. Judge Jenkins is chair of the Enroll North Texas Coalition, where he's led efforts to increase health insurance enrollment. He's worked as an attorney and a small business owner. Prior to taking the bench, Judge Jenkins practiced law out of his own firm, Jenkins & Jenkins. And finally, we're so honored to have Sofia Sepulveda. She works at TOP, the Texas Organizing Project, as a statewide healthcare organizer. Sofia has been a tireless campaigner for healthcare justice. She's a member of the San Antonio Free Speech Coalition. She worked with our Revolution Texas and serves as a Bexar County Democratic Party precinct chair. She sits on the board of Healthcare Now. And she was featured as one of the 25 most influential women who run San Antonio. Thank you again to all of our esteemed panelists. I know this is going to be an incredible conversation. I've been looking forward to it all month. So I'd like to go ahead and dive right in with questions. And Ann, I'd like to start with you just to create a little bit of background and context here for us tonight. Let's start with the sort of the big picture of what's going on at the federal level. Tell us a little about what federal lawmakers did through the American Rescue Plan Act to incentivize states like Texas to expand Medicaid, and then take us through to what's happening at the federal level now.
Great. Good evening, and I'm so honored to be part of this group tonight. Last spring, Congress passed the American Rescue Plan Act and included in it what sounded like an offer we couldn't refuse to get potentially billions in additional federal funding if we went ahead and did our Medicaid expansion. So for Texas and the other 11 states that still have not expanded Medicaid to cover their working poor adults, there was the potential, for a very sweet deal for full federal funding of the expansion for a period of time. It just was estimated for Texas. Estimates were kind of all over the place, but anywhere from $3 to $6 billion over a 2-year period in additional federal funding would have come into Texas. And yet not a single one of the non-expansion states has moved on this. And I think that, or shown any inclination to move on it. I think partly as a response to that, the Biden administration, with the strong support of both, Democrats in both chambers of Commerce, opted to go ahead and include some kind of fix. It wasn't determined at the time in the budget resolution, which is kind of an outline for where they're going to go with the budget. It's not binding, and so we've all been working hard to try to make sure that issue would be carried over into actual legislation. So now everyone on this call has heard about the Build Back Better package, which will go through budget reconciliation. And it has been, folks on this call, Sophia, other folks, there's been a chorus pounding away at Congress, shoring up the president, shoring up both chambers of Congress, saying this package must include Medicaid expansion. And as Marisa emphasized, what we are asking for in no uncertain terms was something strong and something long. We wanted comprehensive coverage for every single person in the coverage gap in the 12 states. We wanted to make sure no one would be left out. And we wanted something that wouldn't go away in 3 years if, God forbid, a future Congress or a future president wanted to reverse it. We do not know at this moment what we will end up with. Probably a lot of you have heard, if you listen to the news a lot, and I know a lot of you do, that the original size of the House package was like 3.5 trillion, and they are now trying to whittle that down to something closer than 2 trillion. One of the ways they do that, not just to this issue, but to dozens of other ones, is by shortening the time frame for them, so the score comes down. So on the one hand, I am thrilled at the possibility that we may be able to see all 12 of these states, people who are, as Marisa said, very disproportionately people of color. It's even higher in Texas. 75% of the Texans who stand to gain coverage are people of color, disproportionately Hispanic. I'm thrilled at the prospect that we may have relief for them on the horizon, but we are not there yet. And so as advocates, we are staying hard on it to try to make sure they hear from us every day until the ink is signed.
Thank you for that. And I do feel like there's a lot of excitement about some of this momentum that we've been able to gain and maybe more importantly maintain at the national level. Do you think there's been anything sort of unique about this year's momentum for Medicaid expansion?
Well, I do think that considering, when we think about it, especially from, well, obviously this federal activity is unprecedented. And so we're thrilled about that. But here, even at the state level, and despite the discouraging scenario that Marisa laid out for us about our regular and 3 special sessions and, the inappropriate priorities being sought there, we have some amazing signs in Texas. As she mentioned, polling just keeps getting stronger and stronger in Texas. Even a surprisingly high number of people who identify as Republicans support Medicaid expansion in Texas. And as she said, 70% polling as supporting it. You see that reflected in what happened in our legislative session, in that we had so many bills filed, including, once again, bills that should have checked every box that a conservative legislator would have needed. And we did have Republican co-sponsors of that legislation. And as Marisa already mentioned, there were enough votes to pass that bill through the House. But that was not the way the politics played out. And the legislative leadership made sure that that did not come to a vote. So it was an exciting time to come so much closer to have bipartisan support for coverage expansion, because, you know, as many Republican members know, particularly from rural areas, this Medicaid expansion would not only help their constituents, you know, would build the healthcare infrastructure and workforce in their districts, but also help keep their hospitals open, which is both, you know, critical to quality of life in a rural community or a small urban community, but also huge for the economy.
Thank you for that. And I see a question in the chat that we'll get to in just a little bit, kind of referring to the fact that, you know, do calls really make a difference when our legislature is controlled by the GOP? And that's where this broad bipartisan support is becomes so important. But because the agenda is usually set by the, you know, the governor, the lieutenant governor, the speaker of the House, it's important that that pressure not just come from the Democrats, but also from the Republicans. And I think everyone here, Sofia Sepulveda, who's with us, she's a community organizer from TOP, the Texas Organizing Project, is very familiar with how everyday Texans with the lived experiences are really informing that policy process. Sophia, can you tell us a little bit? Well, let's back up a little bit first. If you could maybe kind of comment on this, Sophia, when we think about the pandemic, when the rush first started, the wave first started, people wanted to refer to the pandemic as the great equalizer. But we really know now that it disproportionately impacted Black, Indigenous, and Latino communities. Is, you know, in your experience, is there something in the virus that inherently affects us more than others?
Actually, no, right? Like a lot of people, yes, at the beginning of the pandemic, a lot of people started calling it the great equalizer. I remember seeing on Instagram all these movie actors saying like everybody's sheltering in place. So it has put us on a level that everybody's equal. They were not talking about the fact that as you mentioned earlier, it was our people who kept us going, who kept us fed during the beginning of the pandemic. And it is, so the virus doesn't have anything that inherently attacks our DNA because we are people of color. It's not racist at all. It is our policies that are governor, especially on red states that are keep on pushing in our communities that are putting us in danger, right? Like it was the governor who instantly wanted to open the economy. We saw our lieutenant governor also on the news saying that our abuelitos, our grandparents were willing to risk their lives in order to continue to run the economy, right? Whereas we saw people of color, Black, Latino, Indigenous folks going to the grocery stores to put our groceries together, going to the restaurants in order to get us fed, who were the ones who were catching the virus, getting sicker and dying, right? Not to mention like all of that, the virus compiled with the healthcare outcomes that already were affecting our communities, such as diabetes, heart diseases, cancers, that put us most at risk, and in fact took our lives much sooner, right? So the virus is not racist; it is our policies that are being racist.
Yes, that's structural racism, because we also know that in Texas, three out of 4 of those uninsured individuals who would benefit and gain healthcare insurance through expansion are people of color. And I know you've been sort of leading a lot of the advocacy that has gotten us to this point, both here in the state and even at the federal level. Can you tell us about who is fighting the fight for expanding access to healthcare in Texas, and and how sort of everyday Texans with those lived experiences are working to inform the policy process.
Yes, it's not just the amazing organizations such as the Children Defense Fund, Every Texan, and we've seen even leaders of faith coming together in order to ensure that we expand access to healthcare. And when it comes to grassroots organizing, we've seen our community really clamoring together to demand that our governor doesn't fall behind and really expands Medicaid. Unfortunately, as we heard with Dunkelber, we tried this session. We tried to put Medicaid expansion on the ledge, and it didn't go anywhere. And in fact, when we did Medicaid to at least 700,000 Texans, a Republican said, like, this is not right because we haven't had any hearings on Medicaid expansion. But who is the one in charge of putting those hearings if not our representatives, right? So it was very upsetting to see them dwindling on the support. So yes, our community has now coming in force. So they're been calling our representatives. They've been testifying for the 1115 waiver, demanding that they put Medicaid expansion on the waiver. The waiver is the federal money that goes to mental health clinics and hospitals in order to treat the uninsured, right? But they want to ensure that we have Medicaid expansion, right? So it was the stories of these people. We have a member who went with me just yesterday. We were in DC in a press conference. She is dealing with an illness. She falls in the Medicaid gap, and she has to ration her asthma medication in order to afford it because she cannot afford it, right? She's unemployed. She decided not to work during the pandemic because her family is at risk of getting the disease. So she's not working. She's a single mother. She's living with her parents, and she doesn't qualify for Medicaid. If we were to expand Medicaid right now, she will have access to that needed medication. So it's these stories that are super impactful, that I think that it's not only changing the narrative, not just in our state, because a lot of people are feeling the same pain, but it's changing the narrative in our federal government. We saw it yesterday with all these amazing people coming together and demanding Medicaid expansion.
So those personal stories are so powerful because, phrases like "we cannot wait another minute," it seems like rhetoric until you hear stories like that where, access to healthcare could literally be a life and death situation from one day to the next. And so thank you for that. Thank you for your advocacy. And Judge Jenkins, I'd like to go to you next. Judge Jenkins is the county judge in Dallas and has really been a leader in this state when it comes to making sure that residents and Texans are safe during the pandemic. And Judge, I know long before the most recent legislative session, you endorsed a Medicaid expansion solution in Texas back in 2013. So you were sort of ahead of the curve here. What made you think this policy change was necessary even then?
Like I'm muted. I think it's the word now. I think it's very important that everyone have coverage. If you work for a living, you should be able to pay for life's necessity, including healthcare, and pass on a sense of optimism to your children. But for too many of us, that's not happening. As was pointed out by Ann earlier, 75% of the people who are uninsured in Texas, that's 1 in 4 Texans, are people of color. This issue hits me personally. When I was 7 years old, my sister and I witnessed our father suffer a fatal heart attack in a park in Oak Cliff. A week after he was buried, his half brother went to the doctor and was found to have the same congenital heart problem, had a pacemaker put in and some surgery. And he lived another 46 years, long enough to meet his great-great-grandchildren. And so that is playing itself out in families all the time. When you don't have coverage, then you don't have a primary care doctor. So today's high blood pressure becomes a heart attack that takes a father away, or today's high blood sugar that's undiagnosed becomes diabetes that causes a grandmother to lose a limb. And so we need to do everything that we can to push for coverage. I think you are right. This is a moral question. Our leaders are failing us on a moral front because they're not leading based on sound public policy. They're leading based on polling of what right-wing voters in the Republican primary want to hear. Those voters right now want to hear that nobody needs to get a vaccine if they don't feel like it, that you don't need to wear a mask, and that you can sue schools if they try to protect your children. Those voters believe that one of the big problems in our state right now is transgender children aren't picked on enough in grade school, that we need to make it harder for people to vote. We don't need to win elections based on the power of our ideas or our ability to lead. We need to win elections by stopping young people, people of color, and people in urban areas from voting by making it harder and harder and more roadblocks for them. And so we've all got to do everything that we can. There are Republicans who are for Medicaid expansion. You mentioned when I spoke to the legislature in 2013, beside me was the then Republican county judge of Harris County. I've talked to several Republicans on Medicaid expansion, as Ann alluded to, who then pull their name off things because their leadership told them to, but who understood, they're rural folks, understood the importance of Medicaid expansion. But we just got to keep fighting because it's just too important for families. They need to get that coverage.
We've been talking a lot about the impact of underinsurance for those individuals and families who are directly affected. But I think sometimes we don't think about the greater economic costs that the coverage gap creates for our entire community, our counties, our cities, our state, even for those of us who do have insurance. So when it comes to Dallas County, what is the cost of uncompensated care, and how has the pandemic exacerbated it?
Sure. So everybody feels the cost of uncompensated care, because if you're insured, your out of pocket, your copay, your insurance rates are all going up because you've got to pay for the uninsured. 1 in 4 people in Dallas County. If we would take the money from Medicaid, the economic impact of that would be nearly $1 billion a year. With Medicaid expansion, 100,000 people who currently don't have coverage, don't have a primary care, don't have preventative medicine, are going to the hospital for the most expensive and least effective type of care that they can get, would suddenly have access to care and coverage. So it's billions of dollars are at stake here, and there's no good policy reason not to expand Medicaid. It is completely a political calculation on the part of our governor, our lieutenant governor, and I think the Speaker of the House is even weaker than those folks and just went along with them.
Thank you for your leadership on this issue and throughout the pandemic, Judge. And Dr. Perryman, I'm gonna go to you next. We talked about the national level, brought it down to the state, brought it down to our local county level. But now I'd kind of like to move back into the studies and the statistics. Numerous studies have shown notable improvements in states which have expanded coverage. And Judge Jenkins just alluded to some of those. But can you speak about those studies where the data has really borne those statements out?
Sure, and we've been involved in some of those. Other folks have been involved in some of them. But as Ann mentioned earlier, and first of all, it's a real privilege for me to be with this group. And these are people, friends of mine, many of them for many years, people I greatly admire, people on the front lines doing things to make things happen. It's an honor to be with you. But because, as Ann pointed out, 38 states plus DC now have Medicaid expansion. Many of them have had it for many years. We've had a chance not just to do the modeling we did before the fact to say this is what we think it will do. We can now go back and look at some of those states and look at what's happened there and see some of those results. And the Kaiser Health Foundation has done a lot of this, and National Institutes of Health has done some of this. Many others, hello, young man. many others have done some of these sorts of things. And what you consistently find is it pays off. It makes sense. You hear at the time that these things are enacted, you sometimes hear, again, politicians of the type that Judge Jenkins was referring to make all kinds of dire predictions about what's going to happen to their budgets and they're going to go broke and that sort of thing. And it just doesn't happen. In reality, you see healthcare improve, you see outcomes improve, you see uncompensated care decline, you see the state budgets actually prospering from this. And so now when we do our studies and look at it, we not only have the benefit of what logic tells us and what the math of the program tells us, we also have some experience to draw on so we can actually look at what's happened elsewhere. And as I say, a number of people, there have been a number of major studies done that have been very encouraging in this regard and told us basically what we knew would happen in the first place.
Dr. Perryman, critics of coverage proposals point to budget constraints when opposing this policy tool. In your view, what is your response to those arguments? If you could elaborate a little on what those arguments are, and in your opinion, can Texas afford to expand Medicaid in light of the COVID-19 crisis?
Oh, I just absolutely love to respond to that one. It's a complete myth in every way. It's a political talking point that has no basis in reality. When we first started talking about this, and many of us were at the party back then, back in 2013, 2014, we did our first study, literally started the day after the Supreme Court made it optional because we anticipated what Texas might do. And literally our first study, at the same time we did it, Billy Hamilton did one. And for those of you who don't know, Billy was the director of the budget for the state for decades under 3 different comptrollers of both parties, probably knows more about the budget than anyone. He and I both did studies, both showed it would pay for itself. Even at that point in time, we got the one fiscal note that we've ever gotten on this. And even that fiscal note showed, yes, indeed, the state's budget would be better off if they adopted this. And that's without any of the dynamic effects or any of the kinds of things we modeled. As we came into this session and felt like the pandemic, there might be a little more momentum. We had a few enthusiastic supporters. We got a group together with the Methodist Health Foundation providing a lot of the resources to make that happen. Elena Marks and her team, for which we're all very grateful. And Dr. Laura Day at Texas A&M, who's at the Bush School, who's a very, very prominent worker in this area, did a study of this. Randy Fritz, who used to run these programs for the state of Texas, did a study on this. I was involved. Dr. Vivian Ho, who is one of the foremost health leaders in the country, professor at the Baker Institute at Rice. The 4 of us got together, looked at this, and sent a letter to the entire legislature. And again, not counting any of the dynamic effects that Judge Jenkins was talking about, the fact that uncompensated care goes down, the fact that people go to work more, earn more money, and pay more taxes, that the healthcare system gets billions of dollars and more spending that circulates to the economy. Putting all of that aside, just looking at the raw numbers in the budget, nothing dynamic, we estimated that the state would benefit in this biennium between $75 and $125 million net positive gain from doing this, even with the matching funds. And that was before the sweeteners that came into the American Rescue Plan that Ann was referring to, which would have brought billions of dollars more to the state. No, that is an absolutely false talking point. It's been out there from the beginning, and it wasn't true at the beginning. The projection showed it wasn't true, and as we looked at other states, the reality shows it's not true.
And did that number include some of those sort of economic implications of expanded coverage in Texas, or was it just it was just pure budget impact?
This was just a pure budget, putting blinders on just the budget. When you look at the studies we have done and others have done, I'll focus on ours because I'm more familiar with those. I mean, it literally adds, Judge Jenkins mentioned the $1 billion you save in uncompensated care. That brings $3 billion in gross output to the state of Texas in one biennium. In one biennium, when if you look at the increased health spending, that brings $22 billion to Texas in one biennium. When you look at the increased productivity, presenteeism, people being able to go to school and achieve more and be more, look at the lifetime effects of people actually having preventive care, actually having the ability to get treatment early and not too late, not when it's later and more complex and all that. That adds 19 billion to the gross product. I mean, they're staggering numbers. And here's one that you might find interesting. For every dollar the state spends, when you put the dynamic real aspects to it, what really happens in the economy, the state gets back $1.95. Local governments get $1.58. Insurance premiums go down because, as Judge Jenkins says, we're not subsidizing uncompensated care with insurance premiums. And a very important one, because as you have pointed out in your opening remarks and other people have, it's so important here to remember how much of this benefit goes to the least fortunate among us. The long-term income of the folks who are Medicaid recipients only, for every dollar the state spends, goes up $3.06. You're talking about billions and billions of dollars. And what that does is that means less stress on a social service system, more people gainfully employed. It brings just a tremendous number of benefits to the state with absolutely no downside. What I've often said about this, and I know the politics get involved, and we'd all be much better off if this had never been called Obamacare. We all know that from the politics of it, because that caused, even before the recent lurch to the right, that mantra was part of the talking point that kept it from getting a lot of traction early on, unfortunately. But literally, if you are a liberal, if you believe that people have it's a human right and people have, as a matter of human dignity, we should all have health care, you should obviously be for this. If you are a bedrock conservative and you believe that you should do things the most efficient way possible and do the most to give the state the most revenue as possible, you should be for this. It truly should be a nonpartisan, bipartisan issue. But obviously in today's environment, it's not, and that's most unfortunate.
Well, hopefully we're starting to turn the tide, because this is a huge opportunity for our state.
I certainly hope so. If I could just add one,
Sure.
This tacks on to what Judge Jenkins said and what others have said. I talk to legislators a lot, and I talked to several in this session who are Republican legislators who represent rural areas. And as Ann pointed out, our rural hospitals in Texas are failing at a much higher rate. A major study was done on that. The states that expanded Medicaid, the rural hospitals are more viable. They would tell me impassioned stories about how they needed this to protect their rural hospitals and how they would support it. And then with a little bit of pressure applied in the session, suddenly they vanished. And that's the type of situation that hopefully, with some of the activism that takes place and some of the efforts of a lot of the people on this call, and hopefully some of the folks listening, we can start to reverse.
We'll definitely have a lot of folks listening tonight, because we have a lot of questions coming in, and I even have some questions that got texted on my phone here. So I'm going to go ahead and open up the Q&A, because I think our audience is eager to hear from you. So I'm just going to go in order here. And what I'd like to do, I'll ask the question, and let's just try, if I don't direct the question specifically to a panelist, if you have a response, just go ahead and unmute yourself and speak, and let's see if we can operate that way to allow more of a conversation to happen here. So the first question we have here is, can you please explain the discrepancy at the federal level between those who want to expand Medicaid versus those who want to expand Medicare? What is the status of that issue?
I took a stab at that in the chat, so I'll try to make it quick and dirty. I think there are still diehard supporters of, quote, Medicare for all. Bernie Sanders and others still support that. One of the things to understand is when they say that, they don't really mean Medicare the way we know it. They mean something even better than Medicare that would be affordable for everybody and wouldn't have huge out-of-pocket costs and would cover vision and dental and hearing aids, which seniors need. So that's still alive, but Joe Biden from the very beginning was adamant that while that was a good long-term goal, that he was supporting fixing the problems with the Affordable Care Act, and the ones that he is attacking in the Build Back Better package are making the premium supports in the ACA marketplace much better and providing protections that go all the way up the income scale, adding critical benefits to Medicare so that seniors have more of the things that people like me need, and also creating a solution for the coverage gap. So attacking 3 of the big holes in the ACA, not everything that we could possibly ask for. So I think, those ideas are still out there, but it's like universal health care. We aren't there yet. And what's being proposed are just some big steps forward to reduce the inequities in our system today.
I know some of this was addressed in the chat here, Anne, but since we have some folks listening on Facebook Live, I'll go ahead and try to include some of this. The follow-up to that would be, I think there's some questions here about what do we think is actually going to make it into the economic package at this point. If we had to make an educated guess, like what do we think is going to go in there? Any thoughts on that?
Well, I think Sophia and I are on the same page. She was in DC yesterday. What did you say in the chat, Sophia?
The chatter in DC is that both packets are gonna make it to the final bill, right? Unfortunately, we've been seeing what the consensus is, right? Like, so they're trying to take away the child earned credit that now is that we are giving to children every month now. So that instead of the $300, now it's going down to $150. The eliminating the college debt of $10,000, that it's completely gone because they're trying to really start expanding access to healthcare to everybody, including closing the gap and expanding Medicare for, like Ann Dunkelber said, 60 years and up, hearing, dental, and vision. So we are pretty confident we can get both of them at the final bill.
Next question here is from Michael, and he says, I am a Texan in Brooklyn, and I can attest that Texas is viewed incredulously these days up here. Why is there no effective Democratic opposition at the state level to remove such immoral leadership? Judge Jenkins, why don't you take that one?
Well, Michael, thanks for representing us up there in Brooklyn. I think that it's important for all of us to remember that the failed leaders that we currently have in the governor's mansion and lieutenant governor and other key places in Texas do not represent the values of ordinary Texans. You are seeing people step up to take on those Republican leaders. I believe Beto O'Rourke will run for governor. That'll be his announcement to make or his decision to make. I believe that'll happen. And you've got more than one person right now running for lieutenant governor and for attorney general. The challenge that we have is the people that are in power have the power of redistricting, which they've used very well to stay in power. Once again, they just passed that bill in their last special session, and they passed laws to make it harder and harder for people to vote. Voting is like any other thing. If you make it hard for your customers to order from your restaurant, they'll order from somewhere else. They'll give up. They'll make themselves a sandwich. That's essentially what our Republican leaders are hoping for. They're not going to stop all young people who are learning, the ins and outs of how to cast that first ballot, or all people of color, or all urban voters. But that's what it's aimed at. It's aimed at voters where I am, who tend to vote more Democratic, and people of color and young people who are coming up and voting. We just got to do all that we can. What I'm doing is from the time I wake up until the time that I go to bed, I do everything that I can to keep people safe. And that includes right now suing Governor Abbott. And I'm in the Court of Appeals right now because he says our school kids can't wear masks and our businesses can't tell folks to get vaccinated. And I say they will. And so, you know, we're slugging it out in court. We're just going to have to keep fighting. And, you know, I feel like, and maybe it's because I'm a Democrat in Texas, you got to be optimistic to be a Democrat in Texas, but I feel like if we will all give it all that we have, things are about to change here.
Thank you for that. And interesting that you brought up redistricting. And I know that obviously those plans, we've already gotten our first challenge on the maps in court. I'm sure there'll be many more to follow if previous rounds of redistricting tell us anything. But there's actually a question from our audience on how the redistricting maps could impact some of these initiatives in Texas to expand Medicaid if we don't get expansion through Build Back Better.
I'll take a quick shot at that. It makes it hard because when you know that your district is absolutely safe and you only need to worry about the primary, it makes people run hard to the polls in the primary. So in Democratic primaries, it makes people run to the left, but in Republican primaries, it makes people run to the right. And so when you gerrymander up districts, so everyone's district that's a Republican is at least 58, 60%, maybe more Republican. It really gives them a disincentive to listen to anyone else. What you see in redistricting, frankly, is no issue is more important to the elected official than what their district lines look like. And it's sad. That's why we need independent, land drawers, not the legislature doing this. But what they're interested in is making sure that the will of the voters is not relevant. It's the will of the people that put them in office. They want their donors, their primary voters, to keep putting them in office without having to run in a real election. It's a problem.
Thank you. That was Judge Jenkins. He's a county judge in Dallas County. And the next question I have here from our audience is from Juan. Juan asks, starting with Ray, what would you say is the economic mobility effect or implications on an individual or family who lacks health insurance?
Well, it's very significant. And we live in a mobile society. And as you know, we've made some strides over the years in terms of laws that protect the mobility of healthcare coverage for people who have it. And when you don't have it, it limits your capacity to do a lot of things. And if you develop some type of social service system or something where you get some type of healthcare for your family, you tend to have to stay there. If your job doesn't allow you healthcare, your ability to move and do other things is restricted. So that's one of many, many economic implications of this is mobility. That one's becoming increasingly important over time because we're becoming an increasingly mobile society, and the workforce is becoming extremely mobile. And what you're basically doing is in some cases you're making even those other things that give you upward mobility as an individual, you make them more difficult. And as simple a thing as whether or not you have health insurance or not adds 6 years to your life. The people who have it versus those who don't. And that in and of itself affects the mobility and the career path you're going to take and many other things. So there's a lot of dynamics at play here. And obviously we can't model them perfectly. We try to do the best we can and account for as many things as we can, but mobility is clearly a very big issue there.
If I may say something based on what I also hear in the community, right? Like a lot of people, it's perfectly what he said, right? But a lot of people also delay taking care of themselves, delay going to the doctor, right? So the more they wait, the worse the condition get, right? So by the time that they end up going to the hospital, they end up going to the emergency room, they end up going to the staying in the hospital for longer and accruing higher bills, which prevents them from getting ahead, right? So they don't have enough money to pay their the medical bills. They don't have enough money to pay their regular bills, so they stay stagnant. So it's not having health insurance is detrimental for in our poverty, right? It allows us to stay stagnant and not moving forward.
That's very true. And it affects every aspect of things. I mean, as simple as if you have something relatively minor, you have to miss more work because you can't get it taken care of quickly, all the way up to the early detection of cancer, which can literally be life-changing when you're able to detect it. If you're not able to go get the basic care, then you don't find out until it's too late. And the severity, the morbidity, a big piece of that $19 billion or $22 billion in gross product over the biennium I mentioned in healthcare comes from just that. It comes from morbidity and mortality aspects of this, which all comes back to not having an easy way to get into the system. And as Judge Jenkins said, forcing people into the most expensive door in the most expensive building in the system, which is not geared up to provide the kind of care that they need.
I'll take a moment now to elevate one of the comments that one of our audience members made. Pat says, what I know from being chief of a 1,250 bed, relatively new VA hospital is that I had sicker patients with more comorbidities getting better medical outcomes at less than half the cost compared to the big dollar, high reputation private hospital only a few miles away from that VA hospital. The VA hospital clinic saw 100,000 unique patients per year. I'm going to go ahead and go to our next question now. This question comes from Alice. Do we know what the effective date will be of Medicaid expansion if it passes in the BBB Act? Would we still pursue it at the state level if it doesn't?
Well, it all depends on what version comes through. The effective date, if the latest version that we've heard about, which is for several years, people in the coverage gap, so that's below poverty, would be able to get premium free, either no out of pocket or very, very low out of pocket coverage in the ACA marketplace for several years. And that would take effect in 2022, calendar year 2022. So we're co-hosting a conference for application assisters across Texas this week. And one of the things that we talked to them about this week was, if this passes, you guys are going to have a lot of work to do to get those people, another potentially 1 million people enrolled in this coverage. So that's, that would be how soon it could take effect, would be for coverage in January. And I think, again, I hope that we will continue to try to get Texas to do the right thing and to do it the right way. But time will tell, and it will totally depend on how dynamic and long lasting the package that Congress passes is.
We're ready to tackle that 1 million, right, Ann? And on that note, we had a great question from the audience, and I'll go ahead and go to this one now from Ira. Expanding Medicaid could cover 1.4 million Texans, but a total of 5.3 million Texans are uninsured. Why doesn't every Texan also speak up for the missing 3.9 million uninsured? It's like they don't exist. Thank you. So Ann, you're the director of our health policy, and I know you have some thoughts on that.
Well, first thing is, it's a great question. I don't have any problem advocating for the poorest of the poor and for a population that is disproportionately Texans of color and is a graphic example of what institutional racism looks like. You may not have picked that policy because you consciously decided that people of color shouldn't get health care, but that's the effect it has. So we're responsible for it and we need to fix it. I care about the other folks. Ira, we've got probably at least 1 million, maybe a little bit more of our 5.3 million in 2019 uninsured who were undocumented. That's going to be a big challenge for Texas always, because we don't have federal programs that will take care of them, or not directly. So that's going to be an issue for us. But one of the things that we didn't go into details, but the Build Back Better package not only does, massively improves the affordability of premiums in the ACA marketplace, but it also says that no matter what income you're at, you don't have to pay more than 8.5% of your income on premiums. That's assuming you don't have employer coverage. That's massive. That is a massive, it's something that should have been in the bill to begin with, probably was, but in some, in one of those negotiations where they were trying to bring the price tag down, it got thrown out. That's a huge deal for people with moderate incomes who, just can't stand the idea of having to pay this monthly premium and still have a $12,000 deductible, whatever. So we do have steps there. And of course, hardly any of those 5.3 million are seniors, but it is also important to know that there's a lot of hardships for seniors on Medicare currently, that in some ways it is more tailored to the needs of the healthcare providers than it is to the seniors. So, we would also have some, and we do try to live up to every Texan, and we support improvements for coverage for people with disabilities steadfastly as well. So we will continue, but we will not apologize for putting the poorest of the poor first. Thanks.
Thank you for that. And I have 2 more questions here. Has the COVID-19 pandemic compounded Texas's uninsured problem if it existed before the pandemic?
The short answer is yes, and no question about it. I mean, we don't have all the data for that yet. We don't know how bad it's been, but we do have a lot of anecdotal and observational evidence of it. And obviously, a lot of people were laid off during the pandemic. Even with the even with the comeback that we've had, we're still about 200,000 jobs below where we were. And you have to put that in perspective. If we hadn't had the pandemic, we would have gained 250 or 300,000 jobs a year the last 2 years. So we're probably still 500,000 or 600,000 employed people behind where we would have been, but for the pandemic. That translates into a lot more people that are uninsured. Again, we don't know what those numbers are yet. We're not going to know what those numbers are for a little while here, but there's no question you have more people unemployed. And you have the dynamics of the state was interrupted. The state gains 1,000 people every day, more than 1,000 people every single day in population, and a majority of those are either a combination of people of color and including the Anglo population, an even larger percentage of people who are economically disadvantaged. And so as a result of that, we know that the problem is getting worse every day, and we know that the pandemic put some of these issues on steroids for a while. And so again, we don't have the data yet to know that, but no question, it's made the situation more difficult to deal with. And on that score, you mentioned at the beginning, we have 18% uninsured, the national average is 9%. Normally the states that lead in percentage are the very small states. A state with a very small population is one that has a high percentage. We have the second highest population in the state. In the country, we have by far the fastest growing population among any state of any size. And yet with all of that combined, we still have the highest percentage of uninsured by a pretty wide margin. And that's a real problem. We shouldn't be having that here in Texas.
Thank you. I have one final question here, and it is, do other states have this problem? How is the healthcare coverage problem in Texas different from other states?
Yeah, I can weigh in on this to some extent. I'm sure Ann can weigh in on it, and others probably as well. We're not the only state with a problem, obviously. But even going back to 2014, 2015, this first started, we were still in an environment where states that were majority Republican states would figure out a way to do this. And the government gives you some flexibility in how you do it. I mean, I helped Ohio do it. I helped Arkansas do it. I mean, a number of states that are traditionally pretty red states are states that did this. And again, they will give you some flexibility to kind of tailor it to your state and your state's priorities. As someone said at the beginning, one of those, a bill came out this time, I think it was Ann said, checked every box. that you're supposed to check for conservatives, and we still couldn't even get a hearing on it. But yeah, it's not unique to Texas in that there are 11 other states in the same situation. What is unique to Texas is I think that we are so big and our demographics are so starkly as they are, that it creates a much more disproportionately worse impact here in Texas than it does in other places.
I'd like to point out also that in other states, they have the ability to have ballot measures, which we do not have in Texas, right? Like Oklahoma were able to expand Medicaid through a ballot measure initiative that was or community organized driven, right? And they won, and now they have Medicaid expansion. We cannot do that here, even if we wanted to, right? Because Texas has forbidden to do ballot initiatives. So it's much more difficult to get something and pass into law by a citizen. It has to be pretty much by the state.
Well, thank you for that. Really excellent conversation this evening, and I hope it's the start of some follow-ups and some spin-offs. Thank you for all of your work, not only during the pandemic, but beyond, on ensuring that every Texan has access to quality healthcare. And thanks for your time tonight. Thanks for the great questions from our audience. And I'll go ahead and pass it back over to Dr. Johansson and Dr. Estrada for our closing remarks.
Thank you, Marisa. Thank you, all the panelists. This was extraordinarily good, informative, mature conversation about this issue. I would like to ask my co-chair, Bert, what do you think? What's your impressions about this event, Bert?
Like Marissa, I've been waiting for this for months when we first started to plan it, and it fulfilled all of my dreams. I like that we're having this open discussion. And where I come from, we have a phrase, un chin por un chin chin, a little by a little. So I see this by getting the expansion that we can later work on Medicaid and Medicare for all. I mean, a single payer system that fairly treats all of our citizens. So I am really just so enthused by what I heard and inspired what I heard.
Great. Yeah, I think it was timely to have this conversation, even though people may have expansion fatigue. Just finishing our last session, but as I said, this is an issue that's not going to go away, and that we need to continue putting pressure on the legislature and the federal government to come up with a solution so that we can be able to provide health insurance coverage to those people, the 1.4 million and maybe more that are that don't have a safety net in terms of healthcare. Things are much better in El Paso in many issues like vaccination rates. But in terms of access to healthcare, what's going on there, Bert?
Well, as you know, there are some issues legally. There's a large lawsuits involving the Children's Hospital also spilling over to the large. And we also have two of the largest for-profit healthcare systems here, Tenet and HCA Columbia. So we're definitely in a for-profit system, even though we're a town that's 82% Hispanic and about 85% Medicaid, Medicare. I'd also like to remind people, we also have emergency Medicaid and intergovernmental transfer money. And this helps support the poor and the uninsured. But nonetheless, all of those hospitals I just mentioned, and I've worked in each of them, will take your truck if you don't pay your bill. And I say that somewhat facetiously, but I cared for an individual, child had leukemia, and in order to pay the bills, the hospital indeed compounded his truck. We need to move away from that. And and to me, the values that I grew up in was family. You know, I
Yes.
think about my mi abuelita and right behind me, I have what I decided after hearing all the politics, I could tell everybody I'm a liberal. We need to put our children first. Because if we want to change our society and who we are, let's raise our children with the values that we hold, family, our
Yes.
elderly.
Yes. Yeah, so again, I would like to thank all the attendees. Thank you, Mike Oster, from tuning in from Brooklyn. He's been a member of our group for many years. And thank you all, Marisa, in particular. You did a great job in helping us picking up the panelists, and I think I'm being asked to quit now. So yeah, thank you to our panels. He said I still vote in Texas. That's from Mike. To our panelists, we have used their expertise before on this issue, and are very grateful for them being always available and willing to help and to support us. And so again, thank you all for being part of this conversation.